So what is lumbar disc problem? In simple words, the lower part of our spine, this is known as the lumbar spine, and we have multiple discs here in between the bones. So the arrangement is somewhat like this. We have bone, we have disc in between, and then we have bone again. Sometimes what happens, this disc, it comes out of its normal place and it starts pressing the nerve here. Like in my body, if I see, this arrangement is like this. So if this nerve is getting pressed here in the lower spine, then it causes pain to radiate down my leg, which is known as sciatica. Or sometimes it can cause numbness, tingling in the leg, difficulty in walking. Sometimes it can cause weakness of the leg, which is known as the paralysis. Or it can also cause problems related to motion or urine. So in simple sense, whenever we have a lumbar PIVD or a disc prolapse or slip disc, treatment is that in 97% of the cases, we are able to treat the patient with just medicines, exercises, physiotherapy and rest. If that doesn't work, then only surgery is required. Now, the surgery for this lumbar disc prolapse is done by two methods. First is microscopic, second is endoscopic. In microscopic, we use a microscope. Through that microscope, we see what is happening inside. We are able to protect the nerve carefully and we are able to take out the disc fragment that is causing the pressure on the nerve. In endoscopic, we see it over a TV screen. And when we do the surgery, we do it through a tubular retractor system. These days, we have something which is known as microendoscopic, in which we have small tubular retractor systems through which we do the entire surgery using a microscope. So the tubular system is there as well as the microscope is there, that is known as microendoscopic. So normally whenever somebody is suffering from lumbar slip disc problem, whatever your symptoms may be, normally we don't go for surgery straight away. There are just three indications for surgery in case of lumbar disc problem. First is if you have too much of pain radiating down your leg, even after 6 weeks of conservative management. Second is if you have any weakness or paralysis in the leg. And third is if there is involvement of bladder or bowel nerves. So depending on your symptoms, doctor will advise you what kind of treatment is required at that point. However, if surgery is required, whether to go for microscopic surgery or endoscopic surgery or microendoscopic, the treatment or the plan depends on your doctor. What kind of surgery is he comfortable with, or what kind of disc prolapse do you have? Supposing if you have a huge central disc prolapse, then your doctor might advise you a microscopic surgery. If you have a paracentral or a disc which has come out from the side and pressing just one nerve root, then microscopic or endoscopic, both are equally good, because these days in both these surgeries, we don't cut bone. And the scar is almost the size of my fingernail. So depending on your problem, you can discuss it openly with your doctor and whatever is the best treatment that we can offer to you. Thank you.